this is like the slowest game of musical chairs. You get a little bit back. You get me for a little bit more. In working in creating Techonomy, I had the opportunity of collaborating with the whole team there and trying to figure out examples of AI in practice. And we found that a lot of those examples were actually happening in our own backyard. We had the opportunity to find that there were a lot of companies that were actually applying AI in a meaningful way. And we will have 2 sessions where we'll actually explore those, let's call them local examples. And the first one is with Gary Anderson from GuideWell. In preparing for this panel, Gary, and this is something that was illuminated to me, I was doing a little bit of research on GuideWell. And if you have a chance, we have an incredible GuideWell innovation facility that is here in Lake Nona, and I know that they're they're the company that owns Florida Blue, but there is so much more that GuideWell does, and maybe we can start talking a little bit about what the scope of GuideWell is, and maybe we can use as an introduction for talking about specific examples of the use of AI in the medical field.
No, that sounds great, Juan, and I appreciate that, and thank you. It's great to be here. And so many great speakers prior to this, so it's really been good. GuideWell, it does have a large footprint. I think there's a slide up there that you can see that shows in a lot of states, right? Serving more than 62 million people. And specifically here in Florida, like Juan's talking about, there's Florida Blue, part of the Blue Cross Blue Shield Association. So overall, there's a lot that we do, and one of the key components there is the GuideWell mission is relatively simple. It's to help people and communities achieve better health. So when we looked at that, we looked at when AI came out in November of last year, we looked one and said, wow, we need to get into this space. Where can we leverage that? And so what we did is we took a look at some processes in healthcare that everybody finds stressful, right? It's the prior authorization process. Well, we knew a couple of things had to happen correctly, right? We have to achieve the medical guidelines because those are approved by CMS and other regulatory bodies. And then we also have to make sure the physicians that we serve as well as the consumer or member have the best experience. So what we did is instead of just trying to design a process top down, we started to meet with individuals and say, what does it take to get a knee or hip replacement completed to the clinical guidelines? And so to do that, that process normally took somewhere in the 12 days to get that prior authorization approved. So what you see on the screen here now, leveraging this technology and using the clinical record, making sure those physicians, the clinical staff all use the correct forms and have that interpreted in the AI space, 74% of those are getting approved in less than 90 seconds. That's just huge for us as far as an experience for people to work with, so that if there is something that's not approved, then it can go through a process and get approved, and you'll see in the next box, usually in less than 17 hours. And prior to that, that even was taking days and days. So we've seen a lot of great examples right off the bat where we've been able to leverage this technology and make it work for us.
That's incredible. So not only time, which is really what we're looking at in the slide, but the opportunity of delivering better care for the patient population.
That's not only better care, but a better experience, right? What happens when you go and you start to go through an authorization process and that gets denied? Obviously, that's not a good experience, right? So, but if you meet the clinical guidelines, boy, then everything seems like it's working well for you.
Yeah, and it's one of those situations where I assume time is of the essence.
Yes,
right,
absolutely.
where you are waiting for this to happen. Now, we've had conversations as part of the panels yesterday and today, where we look at some of the complexities that come into this space. I mean, the subtext for the conference today is the promise and peril of AI, and it is very clear that for you guys and as a user of your system. For us, it's very important to have that ability to get 90-second approval or sub-day approval on something that we need now. But that comes at a significant kind of investment in terms of,
Yes.
of time and in terms of effort. But also, there's a lot of exposure, right, in terms of compliance, regulatory spaces, privacy.
Yes.
And for us, as an organization with Lake Nona and Tavistock, that has been difficult to navigate. I assume that in the healthcare space, it's significantly more. So maybe you could talk a little bit about that, how that process has worked.
Yeah, no, that's a great question, Juan, because one of the things that we looked at when we wanted to do these types of things and leverage these technologies is we knew that we couldn't use any publicly available models. So right off the bat, as soon as this started to get introduced, we took a chance and we said, you know what, let's partner with NVIDIA and Dell and see what we can do about getting our own internal on-prem language model running. And so right away, we went out and we got 12 A100s and H100s and stood them up in our data center. That way we could use everything in a controlled environment, could answer all of the regulatory and the HIPAA compliance records where you have to be able to audit this information, you have to be able to say who had access to what if it's requested, and keep all of that in our compliance walls and make that all happen. So it was quite complex. And I tell you, there were times where we were on the phone with Dell and NVIDIA and saying, what's going on here? This is crashing. This is just one request we're putting through here. And there was a lot of iterative troubleshooting that had to go on. But when we look at it now, it's really been exciting because we've been able to set up some things where we've got our own clinical language model, our own electronic medical record model. That's all our own information, and we can keep the lock on that. We can audit the records. We can make sure that any kind of bias or control points, it's all focused around that individual consumer. So there isn't the possibility for hallucinations to come in on that because we're keeping it confined to that individual's medical record.
That's something that I think it took a lot of courage for the organization to do, because it's not, it's not that simple conversation to say, hey, I would like to get a bunch of GPUs.
Right.
It's like
those are hard to come
hardware,
by too.
right? The proper ones to bring into the organization, but then to be able to deploy. Did you have any internal resources that were already working on this, or did you guys have to go outside of the organization to get this done?
What we found, what was really interesting, is we did take a quick look outside and tried to see, are there people available in this space that have configured an environment for a large language model on-prem? And we kept coming up with nobody. And those that were available for that, they were already consumed and locked down by Google or some other presenters that are here. So we ended up training our own people. And we've set up like 2-in-a-box scenario because we knew as we train these people, boy, are they going to be marketable or what, right? And so we put 2 in a box and said, look, everybody's got to kind of learn this together. And together we're going to start to be able to implement this, put this out, make these models work, and actually really go back and use some of this core learning to improve other areas of our business too.
That's interesting. What's next? Because you guys have something that is, even though it's groundbreaking for the time that you're actually saving, it's kind of like one of the, let's call it, lowest hanging fruit in the environment that you're in. What makes it unique in your environment is that you have your own models, you have your own on-prem processing environment. But there's a lot of things, and we've heard about some of them today, that are super exciting, both in the practice of medicine and then in all of the different pieces that actually form our healthcare system. What's next? What are you guys thinking of as the next step in moving towards more AI utilization in the organization?
A couple of things, and again, it's good thing to have a discussion on, because we looked at it a couple of ways. We could have gone and said our first initiative was maybe just customer service or some of the simple basic questions, but we thought, you know what, we probably need to approach this from both ends of the spectrum. maybe we should look at a very complex task like a prior authorization, because we've got to have medical records, we have to have physicians involved, clinicians, nurses. You have to get buy-in on all that group. So we thought, well, we better start there. And then also, hey, let's have another path around what can we do more for the members' experience. So when they're calling in, everything from the simple natural language processing to using that language that's coming in, real-time streaming that, and then going ahead and inquiring our database. So for the customer service rep, they get that information up on the screen real-time, makes it so they don't have to do that searching in multiple systems on occasion. They can actually have that already interpreted and brought up for them. Plus, then we have this nice audit trail. So we see that continuum. And then the final continuum that we see using these kind of models, we see that we can create what we've talked about here earlier, avatars for individuals, where they actually have the ability to find their own next best action. You know, because it's real interesting, right? Some people, just to live a more healthy lifestyle, they know what they probably should do, but there's change that has to happen. And that's the hard part, right? So maybe sometimes this avatar that they kind of train on their own can start to learn ways that can help them make change in their own life. So that's our kind of vision or goal that might be long-term aspirations.
Wonderful. So a lot of conversation on the promise of AI, which I'm really heartened by, and it's really good to know that you guys are doing a lot of this cutting edge work. Starting with the complex and going to the simple may not be kind of like the easiest thing to accomplish, but I guess once you're there, you're able to continue. Gary, thank you very much for your time. It's great to have the opportunity to talk to you.